Okay, hello everyone. So in today's session, आज में आप we will gonna discuss about the Nclex based questions, which is related to the postpartum or you can say puerperium period. So everyone, you must be having idea what is puerperium. So puerperium क्या होता है? From the childbirth, okay, till the 6th week is known as the puerperium period. So under puerperium, mother undergoes various changes also. So we will have a discussion which is there for the practice question. Let's start the session. So number one question which you can see on the screen is that a nurse, the nurse is assessing a client who is 6 hours postpartum after delivering a full-term healthy newborn. The client complains to the newborn of feeling of faintness and dizziness. Which nursing action is most appropriate? So what do you think would be the answer? So whether you want to raise the head of the client or you want to send a blood sample which consists of hemoglobin and hematocrit, या फिर हमें इंस्ट्रक्ट करना है क्लाइंट को टू रिक्वेस्ट हेल्प व्हेन गेटिंग आउट ऑफ द बेड और इन्फॉर्म द नर्सरी रूम nurse to avoid bringing the newborn to the client until the client symptoms have subsided. So let's rule out the negative answer. So we cannot avoid a newborn to be brought near to the patient. तो ये तो आंसर नहीं होगा. Okay, the answer for this is 3. ठीक है, हमें क्या करना है? What we have to do, we need to instruct the client to request help when getting out. Okay, so this is the answer. Next question, let's see to the next question. A postpartum nurse is providing instruction to a client after birth of a healthy newborn. Which time frame should a nurse relay to the client regarding the return of the bowel function? Okay, so delivery के बाद, ठीक है, postpartum period में bowel function कब return होगा ये बताना है. So the answer for this, can you guess? So let's have a normal discussion. What happened during pregnancy? Okay, during pregnancy there is progesterone. Okay, during pregnancy there is a progesterone. So progesterone has a function to decrease the GI mortality. So if there is a decrease in GI mortality, ये अच्छे से mortality नहीं होगा, तो mother will gonna have a constipation. Okay, ये slow down the mortality. Similarly, if we talk about the esophagus and all, it also relaxes, the sphincter also relaxes because of the presence of progesterone in during pregnancy. So that's why there is a GERD, that is known as a gastroesophageal reflux, GERD. Okay, but what happened after pregnancy when baby is born? Okay, there's increased chance of having constipation and the bowel. So as a nursing management, we need to check all the quadrants. हमें सारे quadrants देखने हैं for the bowel sounds. This is the main management whether all the bowel sounds in all the quadrants are there after LSCS. So the answer for this is 3. At least 3 days of the postpartum period, it needs time. Because if mother has underwent LSCS and all, so the medication of anesthesia needs some time. Okay, so that because of those anesthetic medication effects and all, so bowel movements do not return back early. So the answer is 3. So let's move to the next question. A nurse is planning care of a postpartum client who had a vaginal delivery 2 hours ago. Okay, so a client who has delivered a baby 2 hours ago, dear. The client requires an episiotomy and has several hemorrhoids. So what is the priority nursing consideration for this client? What can be the answer? So the patient is hemorrhoid and patient also underwent vaginal delivery and all. Just imagine. Okay, the answer will be acute pain. Since it has been asked about the priority nursing consideration, the answer is about the pain. It's not about the urine output or it is not related to the client perception of the body change. Neither the answer is the potential for the imbalanced body fluid volume. The answer is, since the patient is having a hemorrhoid, so it's a severe pain. So let's have some discussion regarding episiotomy and all. बेटा जब episiotomy हम चेक करते हैं, असेसमेंट करते हैं, तो हमें रीडा स्कोरिंग देखना, REED, रीडा स्कोरिंग, दैट इज रेडनेस, edema, ecchymosis, discharge, and approximation and all. So this is done in the postpartum period and all. Okay. So let's move to the next question. So these are the things. For example, a reader score is around 11 to 15. Okay. So in the reader score, the lesser the value, for example, the 2 is good, means patient does not have any problem. The higher the value, there is a problem. Okay. Next question. A nurse is monitoring the amount of lochia drainage in a client who is 2 hours postpartum, notes that the client has saturated a perineal pad in 15 minutes. How should a nurse respond to this finding? Okay, right now the patient has delivered and now within a 15 minutes that is wet. So the answer for this, what do you think? Either as a nursing officer, we need to document the finding or encourage the patient to ambulate or encourage the client to increase the fluid intake or contact. What do you think the answer will be? The answer is contact the obstetrician and inform him or her of this finding. So let's talk about the lochia. If you talk about the lochia, we are having various type of lochia. Lochia rubra is there. Lochia rubra is there. Okay. And the lochia rubra usually lasts from 1 to, you can say approx 1 to 3 or 4 days. Okay. And then we are having a lochia serosa, dear. Lochia serosa from 4 to 9 days. And then we are having lochia alba, which lasts from 10 to 14 days approx, you can say. Okay, lochia alba. So these are the different type of lochia. So what is exact lochia is? It's a discharge in the postpartum period. Okay, the client will always complain that I am having a discharge which is very foul in smelling. That is known as a lochia. Let's move further. Next question. A nurse has provided the discharge instruction to a client who delivered a healthy newborn by cesarean delivery. Which statement made by the client indicates a need for further instruction? So I will begin the abdominal exercise, or I will notify my obstetrician if I develop a fever. I will return to my side and push up with my arms to get out of the bed, or I will lift nothing heavier than my newborn. So the question in this, dear, the question in this is about which statement made by the client indicates a need for the further instruction. That means the statement is negative. The client has made a negative statement and that needs to be corrected. Okay. So the answer is I will begin abdominal exercise immediately. So if a mother underwent LSCS, it's not like immediately after delivery she needs to do exercise. As there's a concept of in the puerperium period, Kegel exercise is important. There's a concept that Kegel exercise needs to be done to strengthen up the pelvic muscles and all. Okay, but immediate after LSCS, it is avoided here. So the answer is 1, that she will start beginning with the exercise. Okay, so let's move to the next question. Next question. Now you can see after precipitate delivery, the nurse knows that the newborn is passive and touches her infant only briefly with her fingers and all. So what should a nurse do to help the woman process the delivery? Encourage the mother to breastfeed soon after the delivery, support the mother in her reaction to the newborn infants, tell the mother that it is important to hold the newborn infants, or document a complete accounts of the mother reaction on the birth records. So the answer for this, can you guess? The answer for this is, dear, is to support the mother in her reaction. Since it's a precipitate labor, so you should know the duration of what is the primary and what is the duration of multigravida. So precipitate labor, when the labor ends within 3 hours, that is known as a precipitate labor. Okay. So the mother is kind of confused. So that's why she's not able to believe that she underwent precipitate labor and all. So we need to support the mother in her reactions to the newborn. So let's have further discussion regarding some puerperium period and all. Whenever you're gonna go for the assessment in the postpartum period and all, there's a concept which is known as a bubbly. There's a concept which is known as a bubbly dear. So in the bubbly, we need to do assessment of the breast, we need to assessment of the uterus, and before bowel, bladder, and the lochia. There are three types of lochia there. In episiotomy, we need to check the RETA score. And in the hormone sign, we need to check about DVT, whether the mother is having a DVT or not. Okay. And then the emotional status is related to postpartum psychosis and all. She might be having psychosis, or you can say puerperal blues in those times and all. Okay. So this is a very important bubbly. We need to check everything because the mother gonna have hardness, which is known as in the postpartum third day. In the postpartum third day, there can be a chance of breast engorgement. Okay, in the first 2 days, the mother might be secreting colostrum, but the real milk start from the postpartum third day, and she is having increased chance of having breast engorgement. So we need to check the temperature of the client and all. If I will say what to check in the uterus, we need to check the height of the uterus. Always remember, immediate after delivery, the height of the uterus is around 13.5. It's around 13.5, and each day after the postpartum period, the uterine height reduced to 1.25 centimeter per day. It reduced around 1.25 centimeter per day. So if a patient today she has delivered and the height is 13.5, then the next day she will going to have the fundal height around 12.5. Okay, approx. So we need to check the whether the uterus is atony, whether it is hard or atony. We need, why? Because if it is atony, there's an increase in chance of having PPH and all. Okay, and also we need to check, it's very important, whether the uterus is any kind of sub involution is there, or mother might be having any kind of puerperal pyrexia. So always remember, there's a question that can be asked that before doing postnatal examination, we need to tell the patient client to empty the bladder. Why? Because the bladder, if the bladder is full or distended, the uterus is shifted to one side. So before doing the postnatal assessment, we need that the uterus should be in proper alignment. Okay, so it's very important. One of the important concepts, one more thing I wanted to tell you about this. Okay, this is last thing about the hormone sign, dear. So this is how the hormone sign is checked, and this sign is checked to rule out whether the mother is having any kind of DVT. Okay, so if hormone sign is present, that means she is having a DVT. If hormone sign is negative, that she is not having a DVT. Okay. Okay. So this then so you can see if she's like how we are going to check that after dorsiflexing at the calf area, this calf muscles, the examiner will gonna press and will ask the client this area, abdomen will press with his right hand side, the calf muscles, or you can say with this hand only, and will ask the client whether the patient is having pain. So on compression, okay, on compression, if the client say yes, that means there's a presence of DVT. Okay, so this was the session. I hope so. You have got some knowledge. So don't forget to subscribe and like my channel. Thank you so much.